5, 4, 3, 2, 1. We are live.
Good evening, everyone. Welcome to the platform of Orthopedic Research and Education Foundation India. Today we have Professor Ananda Kisor Paul. Sir is former HOD of IPGMER and SSKM Medical College, Kolkata, which is now the Center of Excellence of India. And Sir is today discussing about and teaching us about the recent advances in orthopedics, which is usually in the fourth paper of theory exam of MS and DNB used to us. So over to you, sir.
Good evening. So it's a warm welcome from I'm thankful to Dr. Janki, Sharan, Bhadani. He is doing his relentless job for the postgraduate students for the helping to acquire the knowledge regarding this course. So I'm also very grateful to him and Dr. Professor John Mukhopadhaya. He is for his relentless endeavor for the postgraduate students for their learning, and also this experience of the teachers also for preparing these sorts of slides. So without wasting the time, I shall start my topic of today. That is the recent advances in orthopedics. So recent advances in orthopedics, not only it is a topic of the fourth paper, but it is coming in a very big way. And as orthopedics being is a dynamic process, so that as orthopedics being the dynamic process, so there is a recent advance in every steps of orthopedics. So it is. I think the slide is visible now, Janki.
Yes, sir.
Yes,
yes,
okay.
Sir. Yes.
Okay. So it is not only for the postgraduate students for preparation for the fourth paper, but also that may be the topic of their research also. They may take the elements of research from these topics, and also that may be the bread and butter, or maybe their services, orthopedic services, are even after they are passing their exam, and while they are doing their private practices. So how to prepare for the recent advances in orthopedics? First of all, there are lists. See, there are several lists, which is some point of interest during the point of for the examination. Like it may be asked, what are the recent management of recent advances of the management of the intercapsular fracture neck of the femur or the nerve injury? What are the recent advances of the techniques, different techniques of the orthopedics, like cementing technique, screw fixation technique, plates in plate, nails technique, like osteosynthesis, like this? What are the recent advances in different investigations, like suppose what are the recent advances in the investigation for identification of mycobacterium tuberculosis and osteoarticular infection? So like this. Or what are the recent advent of the drugs for biologics in rheumatoid arthritis, like this? So these are the list for this has to be done. And in my lecture, in coming 30-40 minutes, we want to I actually try to cover the most of the important topics, which is the point of interest. So how to make the preparation? I'll again come again. So this is the preparation flow chart is like this. So how you write this? First of all, we have to know the background. Suppose it is asked what are the recent management of the osteoarthrosis. So in that case, we have to start the background. That what is the conventional management? What is the conventional management of the osteoarthrosis? That has to be right in a nutshell. Next point. Always, in the theory paper, in the one how to read the theory questions. In that case, I given the instruction that always make a segmentation. Make a segmentation in different parts, so that it be easy for the examiner to pick up the points. Don't make a essay-like structure. But always make the points segmentation, and keep the left side is a little bit open, left a little bit empty, and write it on the right half of the paper, so that in the left side you can add some flow chart, you can add some diagrams like this. Okay, so we have to start with the background, which is the conventional treatment, then the need. That is what is the knowledge deficit, because based on the knowledge deficit, the recent advances has come. So there is a next point is the knowledge deficit that has to be highlighted very accurately. Next, we have to start the recent advances with this description. There may be some types, there may be some different categories, there may be some steps. So always again there may be segmentation in this section, that is description of this recent advances item. Next, if it is possible, then we have to give some diagram. It may be schematic diagram, or it maybe is very important to give some flow chart. It is extremely important. I will show how the flow chart will be drawn from the different topics. Lastly, this is a very important. We have to chart is a clinical use in orthopedics. What is the important clinical relevance? Next is what is the limitation and what is the advancement and the future that has to be mentioned. Suppose I am giving this in a nutshell, that is all of you know what is that. Is the intracapsular neck femur fracture recent advances. See, this is the biplane double supporter screw fixation. This is the femoral neck system. This is the targon plate. As you can see here, this is the, all of you know what is that. That is the Powell screw, and this is the medial buttress plate. And this is also a hook pins interlocked in a plate. There are several systems. There are some advantage, disadvantage. You have to write it. What is the conventional? Then this same thing. So this is this one. Next is the most important, which is a point of interest, is the 3D printing. What is the basics and application in trauma and orthopedics? Now, 3D printing, this is born in 1980. It is the conventional technology, is a subtraction technology, which is based on the additive manufacturing process technique. Material deposited layer by layer to print the model. What is that? I'll show you. So this is the introduction. We have to write it down in this manner. Why it is required? What is the basic needs? Because there is the advent of minimally invasive surgery and the robotics, because it requires some precision. So precise surgery, minimal invasive surgery for this aspect, this 3D printing has come. Next, most important is a bone more suitable for the parenchymal organs, parenchymatous organs. That is why 3D printing is used for the bone model, for preparation of the bone model is much more accurately than the soft tissue model. Another important is the accurate implant choice. It is required. Sometimes it's required the implant to be placed in accurately. Sometimes some implant may be modified depending on the need of the patient, need of the fracture, or the need of the patient's disease. So in that case, the implant may be manufactured. Modular implant may be selected depending on this 3D printing technology, and that is where in which aspect, in which side it is actually placed. That has to be selected with this help of this 3D printing basic technology. And also plate contouring. They have actually in the technique in our paraoperatively, what will you do? The manually we are doing the plate technique by the permutation combination in manner, but actually accurate plate contouring may be required in some cases for the best functional recovery, and that can be done with the help of this 3D printing. Now, what are the steps? So first of all, the images is taken. It is basically with the help of the CT and MRI scans, and from these MRIs and CT MRI pictures, that the picture is segmented in different slices. It can be done in the manually, or it may be automatic, or in the semi-automatic. Different apps are there that can be used for the slicing of that picture. Once the pictures are sliced enough, so that may make a consistent of a three-dimensional model with the help of a pixel. So how it works, you can see here, this is a CAD file or the 3D scan or the DICOM image or the image library. From this, in any image, we can take this STL file. We make a STL file. The object is represented through the maze of the triangles. So this is like the maze of the triangles. It is the modeling software. Once object is prepared, then the virtual model cut is into thin layers of the equal thickness. The slicing is done with the help of the slicing software, is the G code. So each layer is sent to the 3D printer. So in this manner, it is sliced in this manner. This one, two, like this. There are several slides. There's a make with this help of this image, and every slices should be sent to the 3D printing to machines, and the printer deposits layer by layer to build the exact model. Once the model is being prepared virtually, that has to be represented actually with the help of this polymer, or either polymer or the wax or the metal. So the actual model is prepared that will actually represent the structure which is lost in our body. So in this way, so picture is taken, that picture produced the STL file to make this mesh triangle, and that has to be sliced in a very in equals different multiple slicing software is used for making the slice, and every sliced picture is sent to the printing machine to make a virtual model followed by actual model with the help of this. Suppose see, this is the MRI or the CT scan, and this picture is given. This picture is sent to this. There is a STL file. STL file, it is make a 3D slicing. Every it is made in the multiple slide, and from multiple slide is sent to this the machine, and from this machine actual the model of the vertebra can be prepared. So, suppose this is the case, you can see here, this may be some congenital deformity, or maybe some traumatic deformity, which is leading to some distal radius fracture. Patient is complaining of severe pain. So, how it can be corrected in the clinically? So, they see this is the deformity correction can be easily with the help of the 3D printing. So, 3D printing technology helps. So, this osteotomy, if it is done, that has to be done at least this level higher than this than the deformity level, that can be easily corrected. So first of all, the model should be prepared, and then it can be easily corrected. Once it is corrected, again you can make another model, so that we can check out even before the operation, so that it can be accurately corrected or not. Otherwise, this is a three-dimensional deformity. It is very difficult to correct perioperatively without any preparation. So this is the case. This is the actual case. It is done. You see, this is the distal radial osteotomy. It is already this planning done before the operation, and so during the operation, the job is extremely easy for putting the plate, because everything is predetermined. So how it can be applied? So there is a four main application of the categories of the 3D printing technology, like surgical preoperative planning, the patient-specific implants and orthosis if it is required, so that can be planned beforehand. There is personalized instruments, and the surgical guides may be used, designed before the actual use, and the biometrical construct, that is a tissue-specific scaffold. It can be, I will show how the tissue-specific scaffolds are used for production of the exact the replica of the lost structure of the body. So there's several uses, like the deformity correction, like this. See, there are three-dimensional deformity correction. The deformities are there, and that for that this sort of modules can be prepared before the exact actual correction. Heel stress lesion, that is very important. So it is very difficult to correct perioperatively, but to finding the exact location and to how much elevation is required for making the absolute anatomical restoration. So here this 3D printing will help. Again, old complicated the tibial plateau fracture, this articular fracture, so absolute articular congruity is required to be maintained before the plan, because the actual surgery. Vestibular fracture, again, it is very important. It's a tricky operation. If you have this model beforehand, it's very easy for fixation. Similarly, pelvis fracture, oncology. Suppose this is suppose it's a benign or malignant tumor of the calcaneum. As you can see here, it is removed completely by limb sparing surgery, and that can be easily before operation. That can be easily the model can be prepared, and this model can be replaced on that during the operation. Similarly, spine. So this is the whole vertebral body is damaged initially, and that can be easily replaced with the help of this 3D printing technology. Now, acetabular defects. Now, the total hip replacement is coming in a big way, and there are several important the designs of the total hip replacement. But once there is some chance of failure is high also. So in that case, there are several cases where there is multiple bony defects are seen. So in that case, if we prepare this model beforehand, so in that case we can easily understand where are the bone defects. So depending on that knowledge, if we prepare this sort of manufacture these cups, maybe the modular cup, if it is prepared beforehand with the help of this 3D printing, now the job is become easy to put these sort of these flanges over the acetabular, over the as where there is most of the anatomical landmarks are obscured. So in those cases, the 3D printing will help for this. And again, for the revision TKR or in the complex TKR, you can see here the customization, the implant can be done with the help of this 3D printing technology. Similarly, the orthosis, the preparation designing of the orthosis can be done accurately with the help of this 3D printing, as also the prosthesis. As you can see here, this sort of this powered this foot ankle orthosis that can be used with the help of this 3D printing. Now, approval granted by the China FDA or this Stryker, it is come and it is advanced. It can be what are the advanced use of this technology, that is it can be used for the tissue engineering. What is tissue engineering? I'll come in the next next topic. and that will help in the regenerate the cartilage of the bone, collagen, alginate, and the protein and the hydroxyapatite that can be used for delivering the growth factors, along with some model scaffold models, which is prepared with the help of the 3D printers. And so that can be helpful for providing the replica of the lost structures. So I will show you how it helps. Suppose this is the breast implant, as you can see here, these are this sort of scaffold, and this sort of scaffold is prepared with the help of the 3D printing technology, and that is the opposite size of the opposite breast is used to the picture is taken from the opposite normal breast, and from this scaffold is taken, and there inside the scaffold there are several growth factors are inserted so that that can generate the healthy tissues. Similarly, in the orthopedics also, suppose there are some large areas of the bones are lost. So in that case, these scaffolds are used. Inside the scaffold, there are some growth factors are added, along with some of the stem cells, and the stem cells with the help of the growth factors that would produce and stimulate the osteoblast to produce the growth of the for laying down the normal bones, and ultimately the whole of the bone is regenerated with the help of this. This is known as the tissue engineering. That can be helpful. Now, what is the ATMP? This is another important topic of the day. What is ATMP? This can be kind of maybe asked in your examination. Basically, it is the advanced therapy medicinal products. So advanced therapy medicinal products are the medicines for the human use, which are based on the genes, tissues, or the cells. Basically, there are three types of these advanced therapy medicinal products. It may be gene therapy, which can use the recombinant gene. That is a part of the DNA can be infused, can be inserted in the cells for changing the character, changing the functions of the cells. Now, another is a somatic cell therapy. Somatic cell therapy medicines that they use the cell of the tissue as a whole for changing their biological character that can be inserted in the host tissues. From that is taken from the donor tissue that can be changed in the laboratory. Their character is changed, and the whole cell of the tissue is infused in the host tissue for serving a different functions. Now, tissue engineering medicines, I've already told that they use the cells and the tissue which is incorporated inside the scaffold. Scaffold is basically the mechanical structure which is bioactivated with the help of the cells and the growth factors. And the cells, there is mesenchymal stem cells with the help of this growth factor. They produce the exact cells which is required inside the body for the repair, regenerate, as also to replace the human tissues. Now, what is the stem cells? Now, stem cells basically the cells which have the capacity to both the self-replicate and give rise to differentiated cells. That is basically the stem cell. There are different types of the stem cells, like embryonal stem cells, which are basically the totipotent cells. Totipotent cells, they can produce any type of cells. Pluripotent cells, basically they are depending on the differentiation. It may be produced the ectoderm, mesoderm, and the endoderm. Now, adult, basically they are the pluripotent stem cells we can found, and among the pluripotent, that there may be some multipotent stem cells. Suppose the pluripotent stem cells may be hemopoietic, and the mesenchymal stem cells, and the mesenchymal stem cells may be multipotent stem cells. Multipotent means mesenchymal, they produce some connective tissues. They can produce the osteoblast, they can produce the fibroblast, they can produce the chondroblast, like this. So mesenchymal stem cells, they basically is the one form of the pluripotent stem cells. They are basically they can produce the multipotent activity. Now, mesenchymal stem cells is selected as having the low immunogenicity in comparison with the hemopoietic stem cells. And so it doesn't have a low immunogenicity, but it also has the immunological modulation and able to modulate the immune system of the host. So that is why, so among all the pluripotent stem cells, the mesenchymal stem cells is selected for our treatment of the stem cell therapy. Now, mesenchymal stem cells, as this ATMP, that is basically it is a multipotent stem cells. The sources from where it is collected. It can be collected from the bone marrow, adipose tissue, synovium, umbilical cord, periosteum, cartilage, skeletal muscles, and the skin. Now, what are the characteristics? Why it is selected? Because it is easily identified by the cell-specific differentiation markers. There are several cell-specific differential markers that can be used for their identification. They are able to adhere to the plastic surfaces, because it is important when it is in the tissue engineering that can be introduced inside the scaffold. So it is important. Next, they are able to migrate to the target of the injured tissues and express their immunomodulatory activity and show the paracrine effect. This is important. Suppose in the osteogenesis imperfecta, there is a defect in the collagen tissues. So the stem cells can be either is locally infused or it may be introduced inside the blood. So if it is infused inside the blood, they can circulate all over the body, but they can be deposited in a specific connective tissues of the organs, so that they can change their character, so that they can act. So that is why it is mesenchymal stem cells are used. And then not only that, that can differentiate into osteoblast, chondrocyte, and the adipocyte, as I mentioned. Now, there are two types of mesenchymal stem cells as per Committee for the Advanced Therapy. There is a CAT, that is a tissue, either it can be used for the tissue engineering or the cell therapy. What is tissue engineering? I already showed, that is scaffold is used with the help of the 3D printing technology, where the stem cells are introduced and the growth factors for making the replica of the lost structures. And so when the mesenchymal stem cells are substantially manipulated, where structures is used for this purpose, it is known as a tissue engineering. Where is function, there are different functions are used. That is the immunological function, pharmacological functions, or the metabolic actions are used for this specific lost function. It is known as the cell therapy. Now, the several uses, like non-orthopedic uses, like diabetes mellitus, Parkinsonism, Crohn's disease, hematological disorders, and orthopedic use. What are the orthopedic use? It is in the non-union with bone loss, spinal fusion, PIP, that is a plus indefatigable piece, avascular necrosis of the femoral head, focal articular cartilage deficiency, tendinopathy, and the osteoporosis. Now, what is the future of the mesenchymal stem cells? Now, use of mesenchymal stem cells to the cell-free mediators, like the exosomes. So, without cells, only the exosomes, which is extracted from the cells, that can be transfused into the host for changing the function of this particular organs. That can be used in the future. Another is important is genetically engineering. That means that the cells which is mesenchymal stem cells which is already prepared for transfusion, then in that cells the genetic studies, genetic infusion can be done in those mesenchymal cells which are ready to transfuse. So this is not that the genetically engineering. So the genetics therapy, the genetically treated mesenchymal cells that are prepared, which are ready for the use. I will show how it can be used. This is also important in the future. Now, there are several obstacles for the use of these mesenchymal stem cells in India, like the incoherent rules and the regulations and non-statutory guidelines, whether only the two departments they can allow to make the study, like Department of Biotechnology and the ICMR, but they are still today they don't have the authority for providing their permission. And that the monitoring committees, which is extremely important before any starting the stem cell therapy. But most accepted in India, it is autologous postnatal mesenchymal stem cells therapy is required. Now, tissue engineering, I already told what is that. Tissue engineering is an exciting strategy that employs the stem cells, scaffold, and the growth factors or the mediators, either in isolation or in combination, for replace or regeneration or repair of the lost structure. I already showed it. Now, what are the required agents? Required agent is the scaffold, mesenchymal stem cells, bioreactors, and the growth factors. So this is already you know. So any student, they can write it in this way. Now, what are the scaffold? So what is a scaffold? Basically, it is a structure which can deliver or retain the cell and allow for the cell attachment, which has adequate biodegradability, biocompatibility, and the non-immunogenicity. So this criteria should be there, so that that may act as a scaffold, and that can be prepared with the help of the 3D printing. Now, what are the types? Basically, there are most important commonly used types is the sulfated polysaccharide based scaffold, which are best as they mimic the structure of the bone and the cartilage, high growth factor retention capacity, and the porous nature. There are several others scaffolds like hydroxyapatite, there are different polymers. I'm not going into detail. There are several types. Anybody can write it. So basically, scaffolds are used in this tissue used in the tissue engineering, and that can be used in the congenital defects, tumor resection and their replacement. As you can see, I already showed it. Fractured bone with large bone loss, how it can help, I already showed it. To production of the internal prosthesis, which is customized, which is specifically designed for the patient-specific diseases or the deformity, or the external prosthesis that can be used. I already showed it. Now, scaffold prepared based on the original structure. This is basically in a nutshell. They can write it like it is, just make the schematic diagram. So that is why I have given the slides. So this sort of schematic diagram can be easily used. This is a bone loss. The scaffold is used along with some growth factors, or the bioreactors are used, and this ultimately the bone is degenerated. Now, recent management of the meniscus injury, that there is that same technology can be used, and that can be asked separately in our examination. Now, what is the basic structure of the meniscus? So you have to write it down in this manner. So this is also again its schematic diagram. Center contains the meniscus is a specialized structure where the central part of the meniscus contains the fibrochondrocytes, where the peripheral part contains the fibroblast-like cells. And also in the matrix, most important structure is the aggrecan, which is as a major proteoglycans. So everything to be replicated with the help of this technology. Now, what is the conventional management? We have to write it. What are the conventional management of meniscus injury? Non-operative management, anti-inflammatory drugs, strengthening exercise, modifications, the activity of the daily living, unloaded, everything we have to write. Now, what are the conventional surgical treatment? So this is the arthroscopic, total or the partial meniscectomy. This is the most important. Next is the meniscus repair, and the meniscus reconstruction is the latest, with the help of the meniscus scaffold and the meniscus allograft transplantation. So this is this conventional surgical options which is available. Now, meniscus transplantation is the alternative management options because it can be used for the selected patients with previous complete or the almost complete meniscectomy. It cannot be used for the all patients, because it's some selected patients and selected indication you can use, like those who are skeletally mature, younger or younger than 45 years. These subjects can be selected for this this treatment with mild unicompartmental degenerative disease, but there's normal mechanical access of the knee joint. So these are the ideal candidate for this meniscal transplantation. And there are what are the meniscal substitution? There are three types of meniscal replacement. Or maybe use the autografts with the help of the tendon, fat, and or perichondral tissues, allogenic transplant with the help of the cadaveric structures, or the artificial meniscus prosthesis. As you can see here, this is a polycarbon urethane meniscal implants with a stainless steel fixation bolt that can be used. The meniscal autografts, you have to write it down in this sequentially. What is a meniscal autograft? What is all allografts like this? Meniscal autografts, you have to use the patient's own tissue with no immunogenic reactions. What are the tendon autografts? It can replace the entire meniscus. They can use the size, any size of the meniscus, relatively fast patient recovery. So these are the points to be noted in our this autograft. Now, allograft is basically is for the knee joint restoration, but it has some multiple limitations like mismatch between the donor and the recipients. There is a dearth of availability of the donor tissue in many countries, and technically demanding operation, and its longevity and possibility of the disease transmission. It's a question. Now, artificial, how to prepare the artificial, anatomically artificial meniscus. So these are the steps. These following steps are used. First is the preparation of the anatomical picture of the meniscus that can be taken from the excised meniscus during the TKR or the MRI scan of the healthy volunteers. So this picture is taken first. Now, from the picture, the 3D scaffold, 3D picture is taken, 3D picture is prepared, and from the 3D picture, the scaffold, original scaffold is prepared with the help of the polycaprolactone scaffold. And inside the scaffold, we have to add the mesenchymal stem cells, followed by the bioactivation of the scaffold is done with the help of the synthetic polymers, cell latent, the decellularized meniscal extracellular matrix. And then finally, so this is actually the scaffold, which is loaded some bioreactor, and this loaded this bioactivated this scaffolded structure, which is already original replica of the meniscus, that can be inserted in the original in the host structure, which is already the meniscus is damaged. Now, what are the different technologies can be used for production of this anatomical meniscus, like the wedge-shaped porous, there is PCL scaffold, or the hydrogel-based scaffold. So I'm not going into detail. These are the technical terms that can be used for the exact anatomical meniscus. But it's one step ahead. There's not only the anatomical, but also it's the exact functional, exact accurately functioning meniscus, how it can be obtained. So if it is inside the scaffold, along with the bioreactor, if we add this, that is polyglycolic acids, microparticles carrying the transforming growth factor beta, the TGA beta 3, or connective tissue growth factor. If we add these as a bioreactor, that can not only that simulate the exact meniscus, but also it can act as a native meniscus, which is a long-term condor protection can be given. So that there is this functionally as well as function, that is structurally as also functionally accurately replica of the meniscus of the original given God-gifted meniscus that can be provided to the host. Now, there are several advantages and disadvantages of this 3D printing technology for meniscus regeneration. I'm not going to detail. It is always written, so that can be used. That can be written like advantages of fabrication, the complex structures in a very simple manner, use of various types of biomaterials, use application of the computer assisted methods. Disadvantages are specialized equipment is required, which is expensive. Its production time may be more. It may be highly specific protocols. Now, with the help of this knowledge, that another important topic may be asked: what is a recent therapy in osteoarthrosis? Now, osteoarthrosis, regenerating strategies of osteoarthrosis, cell-based approaches. Apart from the conventional approach, you have to write it down first. The conventional approach. Next is cell-based approach. In the cell-based approach, most important and effective is the autologous chondrocyte implantation. Next one is the mesenchymal stem cells, medicinal signaling cells as the Arnold Kaplan, and the pluripotent stem cell. These are the osteoarthrosis cell-based approach. But unfortunately, majority of the cartilage repair studies using the mesenchymal stem cells have failed because of the several causes, like their insufficient capacity of the chondrogenic differentiation, poor potential for immunomodulation, or the development of the hypertrophy. So because of this reason, the stem cell therapy usually fails in osteoarthrosis. So how it can be rectified? So this biological drugs, that is that you have to, it's the genetic engineering. That means that the mesenchymal stem cells, which is going to become prepared for the transfusion in the host cells, they have been infected with the gene, and that genetic change is required for these mesenchymal stem cells. So this is the genetic engineering. I've already showed it. So there's that genes, that is the delivery of the nucleic acids in the damaged and the diseased tissue is required, and which is it can be done with the help of either viral vectors or the non-viral therapies. So viral vectors, that is the viral, because it is easy to infect by the viral infection. So the virus carrying this gene that is transfected, that easily used for transfection of these mesenchymal stem cells. Similarly, there are some non-viral carriers also, which can carry this sort of genes for introduction of the mesenchymal stem cells, which are ready to transfuse in the host cells. And there are several these carriers like lipid-based system, the DNA conjugates, messenger RNA, that can be used for the carrier of this gene. There is a part of the DNA for transfusion inside the mesenchymal stem cells, which are introduced. So gene therapy approaches, it may be direct delivery system or in the indirect delivery system. I've already showed the virus containing this part of the DNA that can be infused directly, or the non-viral vectors that can be used directly inside. This is a direct delivery system inside the joint. Or there is an indirect delivery. That means cells are taken from the synovium or the adipose tissue, when the mesenchymal stem cells are isolated, and the mesenchymal stem cells, they are actually infected with the help of the viral vector or the non-viral vectors, and there's bioactivated mesenchymal stem cells that can be again inserted inside the affected joints. So this is basically, it is a gene therapy. It is targeted and sustained delivery of the therapeutic agents or growth factor genes, a small regulatory components of the microRNA inside the cells. That is basically the gene therapy. So how the gene therapy helps in the osteoarthrosis? because these bioactivated mesenchymal stem cells are genetically change the mesenchymal stem cells. If we transfuse inside the joint, they enhance the chondrogenic differentiation of the mesenchymal stem cells inside the joint, which produce the that will produce the original chondrocytes, original articular cartilage inside the focal defects of the osteoarthrosis. Moreover, the gene therapies can enhance these mesenchymal stem cell immunomodulatory properties. Not only that, they stimulate the anabolic chondrocyte responses in the damaged cartilage, even and inhibit the anti-chondrogenic factors like the matrix metalloproteinase, which is responsible for the cartilage degradation. That the cells which is already given inside the damaged joint, that can act as that is opposite to that matrix metalloproteinase that inhibit these anticholinergic factors. Now, what are the future trends? Genetically engineering, that is the mesenchymal stem cell that can attach to the extracellular matrix in the cartilage, which is a concept which is tried and tested more than in 1 decade ago. Now, the emphasis appears to have shifted to modulating the chondrocyte metabolism or their paracrine activity, and altering the inflammatory milieu of the microenvironment inside the diseased cartilage, or inside the focal defect of the focal defect of the cartilageous defect inside the osteoarthritic joint. So that is the future trends. Now, what are the disease associated with some defective genetic aspects? The osteogenesis imperfecta, there are several lists of the diseases. What are these diseases do? They basically, these diseases affect the bone mineral density. They can cause either the osteopenia or the severe deposition of the bone, that is the high or the low mass syndrome. So basically, the abnormal genes which is identified are the low density lipoprotein receptor related 5, that is the LPR5 protein, which leads to osteoporosis. Another gene, the LRP4, which causes the bone overgrowth. So that by impairing the sclerostin facilitating function. Now, vitamin D receptors are there, which can control the bone mineral density, and also the collagen. There is A1 and A2 that will control the collagen inside the bony and ligamentous structures. So these are the abnormal genes which is identified. Now, in the osteoporosis, how it acts. In osteoporosis, the recombinant adeno-associated virus, this is a virus carrier-based gene is introduced inside the osteoclast. So there cannot be once the osteoclasts are infected with this viral carrying the genes, carrying this abnormal, carrying the therapeutic genes, they become inactive and silent. So the osteoclast becomes silent, and their osteoclastic activity is restricted or limited, or it becomes stopped completely for bone resorption. So in that way, in osteoporosis, so the osteoporosis we can treat with the help of the gene therapy. Not only that, there is SHN3 is identified, which is a potent suppressor of the bone formation. So we can directly target that SHN gene with the help of this gene therapy, and which can make the silencing of this that specific gene, which is responsible for bone suppression of the bone formation. There are other alternative approaches like the acidic amino acid oligopeptides or the calcium-based nanomaterials, which can be introduced inside the cells for production of the osteoblasts, for stimulation of the osteoblasts.
Excuse me, sir.
Yes.
Sir, maybe take few questions before, sir.
Yes, please. We can take some questions.
Yes, please. So, can you please so stop the slides here?
Okay.
Then we.
Okay.
John sir had joined. Yes. Okay, sir.
Good evening. Good evening.
Good evening, Dr. Pal. That was great. I think it sounded almost like science fiction there. But
Yeah. Okay.
So,
there should be questions from the.
yes. We have a question from Dr. Narayan. Is there any role of umbilical cord blood stem cell in regeneration of ligaments and meniscus?
Yes, umbilical cord stem cells. It is basically a source of stem cells, but for the bone regeneration, it is not being very popular. For bone regeneration or for bony defect, there are several other stem cells is already available, which is very easy to collect from the native joint. It can collect from the synovial tissue. So there is no requirement of this umbilical cord stem cells. Yes, stem cell preservation, now it is being a statutory treatment or policy in every newborn babies. But I don't think it is not become popular for this bone regeneration, because there are several other processes already available. The stem cell which is collected from the synovial tissues is very easily available, so it can be used now.
So another question they asked is the difference between totipotent and pluripotent cells.
Yes.
You have mentioned.
Totipotent is basically it's an embryonal stage where that was simple one or two cells that can produce every cells. So this is non-specific. That is known as the totipotent. Now pluripotent is basically, it is little bit differentiated. They can produce some ectoderm, endoderm, or like this. So ectoderm, they can produce the skin and connective tissue. The mesoderm, they produce the connective tissue, and the endoderm, they produce the viscera, like this. So pluripotent has some specific function. Now, suppose there is the cells which is mesenchymal stems. This is one of the pluripotent, one of the categories of the pluripotent cells. They may be unipotent or maybe multipotent. So it's so any pluripotent cell, they can produce any single specific function or multiple function. If it is a single specific function, that can be the unipotent cells. If it is multiple function, there is a multipotent cells. So in that sense, the mesenchymal stem cells is a multipotent cell, because they can produce multiple cells. They can produce the osteoblast, they can produce the chondroblast, they can produce the osteocyte like this, or chondrocyte like this. So in that sense, that is why the mesenchymal stem cell is selected among the pluripotent cells.
Okay, so one question, sir, about any re-emergence of the previous implants nowadays. Like, sir, we have in the newspaper also that few of the players are having that replacement with metal on metal. So is there any role of metal and metal now, sir, in THR?
Metal, this is we want from tribology, no? Yes. Tribology. I have in our lecture tribology. So there is a metal on metal tribology. Basically, so, I'll discuss. Okay. Any question? Please complete your question.
So another thing, sir, I want to ask about that. That recent advances, it is very much chance of asking question related to COVID-19, like the protocol and all. So what is about the current practice in COVID-19 and the change, any guideline or changing trend in orthopedics is there because of that?
No. So COVID-19 related question will be the how will you change your practice. So that is only the question is required. How will you change your orthopedic practice depending on the COVID scenario? That question may be asked. Otherwise, that should not come. Any sort of medical complications. Basically, how the COVID infection. Just I'm giving to a nutshell. The COVID-19, how it enters inside the body. The COVID virus enters inside the body with the help of the ACE2 enzymes, which is basically it is a property of every cell. Basically, it comes in the respiratory tract or in our pars patch in our GI tract. So it actually infects those cells, surface cells, which is well equipped with the help of the ACE2 receptors. So and then through this gateway, they can comes inside the body. And they produce some immunomodulation inside the body that can produce cytokine storm, and that ultimately that causes the multiple organ failure. That is the basic pathology. But what is the orthopedic point of interest, how to take some precautions during this COVID scenario? Suppose how will you select the suppose an emergency case has come. So what is the protocol to take that? So we have to take every precautions, like we have to take with the help of some specific mask, some exhaust mask, some oxygen generator mask, or every special type of mask we can use for attending them. So every precaution to be taken for preventing infection of self. Now during the emergency operation, second, the emergency operation should be performed taking every precautions. Now suppose it's a cold operation. So in cold operation, you have to take the help of the RT-PCR test. The RT-PCR test is valid for only for 72 hours. So remind that. So if suppose it is a polytrauma patient, we have to take some damage control orthopedics. So in that case, that may exceed some 4 or 5 days. So in that case, we have to repeat the RT-PCR test. So these are the issues to be discussed in our COVID scenario. How do you change our orthopedic practice? I think that this sort of question may be asked.
Yeah, so there's also one other issue which is the post-COVID patients like arthralgia, myalgia, weakness, etc. I think AVN because of steroid use. So there are a number of things which you can also, that could be one of the questions, the complication, orthopedic complications of COVID.
Yeah, that is valid. Yeah, post-COVID avascular necrosis is rampant now. So how do you prevent that and that this sort of?
And also arthralgia, all the joint pains. We get a lot of patients who previously did not have joint pains and now end up with very much like arthritis and stuff like that. It's still something that's evolving, but
specific polyarthralgia.
Yeah.
Specific polyarthralgia like.
Okay, so like post-viral arthralgia, these because we are seeing in OPD more number of cases where we are not able to diagnose the cause of pain. Maybe.
Yeah, so that's a possible.
That may be because of this COVID.
Post-viral polymyalgia or polyarthralgia, it is very common. And that's one of the important factors is related with this hypovitaminosis D. And this is also very common with this.
Yeah, and apparently someone told me that they're seeing, a pediatric surgeon told me that they're seeing a lot of rickets post-COVID.
Yes, hypovitaminosis D. Yeah.
So that's another issue there, which I don't think it's been written about, but this is just something.
Exactly.
So about the recent advances in the oncology, is there any development recently which can be asked?
Yes, in oncology there are several, like first of all the diagnostic. Now the diagnostic criteria recent advances is already basically it is a core needle biopsy. Now core needle biopsy, that is with a specific area, and that has to be done by the surgeon which are going to become the operated the next sitting. So the same surgeon that has to be done, that exact site should be selected, and with the help of the either the USG or the CT, that the CRC arm, that we have to select the exact site for the core needle biopsy. This is most important. Next one, suppose if there is some malignant tumor also. So in that case also we can perform the limb sparing surgery. So even in presence of the malignant tumor, if there is no dissemination, if only there is a locally malignant. So there is so in that case, we keeping the compartment intact, we can preserve the neurovascular structures and we can dissect it. There are several techniques are there. So you can just isolating the neurovascular structure from the tumor. So that specific techniques can be used, and with the accurate removal of this tumor, the similar replica of the bone, the whole femur may be replaced with the help of this 3D printing. So before that, the whole femur, exact femur, can be prepared with the help of the 3D printing technology and with the help of the tissue engineering. And first the scaffold is prepared, as I've shown it. Scaffold is prepared with the help of it is bioactivated with the help of the mesenchymal stem cells and the tissue growth factors, and along with that some bio activators are added, and this bioactivated scaffold can be used for the replacement. Whole femur can be replaced, whole tibia can be replaced. So this sort of technology is a new one for malignancy oncology.
That means if it is a locally malignant tumor, like in the femur, we can save the tibia and replace the femur. Like we can save the limb.
Yes, but we are very much sure that there is no distant metastasis, distant, or there is some compartment invasion. If there is a compartment invasion, then there is nothing to be done other than amputation.
Still, there is actually no end of modern newer treatments. So you also have all these radiation of the tumor and reimplantation and things like that, or liquid nitrogen therapy of the excised tumor and putting it back in, etc. So those are this. Then you have growing total joint replacement, so they can be lengthened along the way. So there are lots of other things that every.
Okay, so even for the total joint also that can be growing, sir. Like
yeah, they have that, but it needs to be done so far. So they have to come in and get it lengthened and then go back. But I'm sure soon there'll be motorized ones or something like that.
So I have seen for the Jones that previously that botulinum toxin used in cerebral palsy. What is the guideline if it is?
Yes, it's a good question. Suppose there are two, for clinical interest, there are two forms of deformity in sort of these neurogenic diseases. It may be due to spasticity or it may be to contraction. So we have to, as spasticity is a velocity dependent. So in that case, suppose there is some equinal deformity, you have to make a certain correction attempt. So in the first stage, there is a one stop is there. There is R1. And if it is further, if we make the sustained range, there are another further correction. It's R2. Then suppose an equinal deformity that has been so that can be corrected in this manner by velocity dependent manner. So there is the R1. If the R1 R2 is same and it is less than dorsiflexion, that means it is a contraction. But if the R1 R2 is different, so first stop is suppose it is 30-degree flexion, plantar flexion, but after all it is fully corrected. That means it is basically it is a contraction. It is a spasticity. So if it is a spasticity, then only there is a scope of this sort of botulinous toxin. Now, how if the botulinous toxin will work or not? How do you know that? So in that case, so there is a musculotendinous. We have to select the musculotendinous junction, and in that musculotendinous junction, we have to inject some phenol and alcohol solution. So that will cause the temporary blockage of this neuromuscular transmission inside the muscle. So if that will help, so that immediately after the injection, suppose after the 10-15 minutes for the injection, that will be completely corrected. So in that indicates that will work. So if it works, then only that ultimately these candidates are selected for this botulinous toxin. But that it is only in the pediatric, but not in the adult. The adult, it is very difficult. So only the pediatric age group that can be attempted.
Yeah, although so recently there's been a move away from the use of Botox, especially multiple injections of Botox in CP because of some of the associated complications with it. So I think this is a changing situation. Botox is not totally without complications.
Okay. And so one more question about the current updates in arthroscopy. Is there any recent advances which can be? Because years back they have asked, like you have mentioned about the meniscus. Other than that, is there anything?
Yes, the arthroscopy means that there are several some different bioactive 3D printed structures, scaffolded structures. I've already shown it. So that can be used with the help of the arthroscopy, that can be accurately implanted inside the joint. So without the help of the arthroscopy, you cannot accurately implant. That is the most important stuff. So I think there are several portals that can be used apart from the conventional portal. So that may be used for that accurate positioning of this artificial meniscus. I think that is the for the advantage.
So there is one more question from Dr. Anjit.
Yes, any recent guidelines for paraplegia? Yes, paraplegia rehabilitation. Yes, paraplegia rehabilitation is basically, so once both the lower limbs are paralyzed, so how can it be rehabilitated? So that is the question. Yes, if it is there, so in that case, both the lower limbs is paralyzed, only the upper limb is remaining. So in that case, the most important muscles which can be used for rehabilitation is the latissimus dorsi. So latissimus dorsi is basically is a typical muscle which can connect the upper limb along with the lower limb. So if we trains the latissimus dorsi in a specific manner, so there are several ways, like with the use of monkey paws. There are some throwing technique. There are some lifting technique. There are several techniques, physiotherapy techniques are there. So by which we can develop this latissimus dorsi with a specific function, so that in a standing manner, once the patient can stand with the help of the parapodium. The parapodium is the structure which can fix the trunk with both the lower limb. So once both the trunk and both the lower limb is fixed with this parapodium, so the patient can move the body in this manner with the help of this just rotating manner. They can rotate the whole of the body with the help of this latissimus dorsi, so they can propagate the whole of the lower limb, which acts as a single piece. That they are paraplegic now, so they cannot move. But with the help of the upper limb, rotating the body of the upper limb with the help of this latissimus dorsi, they can propagate with the help of this parapodium. So basically, that is basically the way of the recent way of rehabilitation in the this paraplegic. But before that, there are several other techniques are there, how to make the standing, how to make a stand the patient. So there are some structures which can make it like a the metal structure, which will help the patient to make a stand, so that there are some propagatory stimulation is going to the brain. This is also important. So we have to prepare the patient before that stage. So the standing, the feeling of standing, feeling of sitting, with the help of this orthosis, and then after that we can develop the latissimus dorsi, and after that we have to use the parapodium. They can walk. That is the.
And also some other trunk muscles which may be spared depending on the level of the lesion of the injury. So you can use that. The other thing is there is work going on stem cells.
Yes.
This is still a big area of controversy. So it's better that you read about it and find out what are the authentic papers on it. And it's being used by a lot of people to, I think, get patients to pay a huge amount of money for some treatment, which there's very little strong evidence that works. So it's some an area of ethical concern at the moment.
So he's also want to know about, is there any recent guideline for rehabilitation in paraplegia?
That is the recent guidelines. Means in paraplegia, first of all, we have to protect the skin and the multiple organs. Skin care and the multiple organs. This is most important. So first is the care, skin care, multiple organ care. We have to change the position. We have to take the care of the respiratory tract, gastrointestinal tract. So this is most important. Next one is the mental rehabilitation. We have to motivate the patient. This is second point is once all the other body parts is intact and they are ready to become rehabilitated. Next is the mental rehabilitation. Mental boosting is required for the next step. Next one is the third one is the this preparation of the patient for that is mobilization. That is with the help of this. I've already told there are several techniques like the stimulation. There are the galvanic stimulation that can be used on the muscles that can produce some neurotransmission to the brain, so that their limbs are there. There's this feeling that can motivate them for the next step. That is the feeling of standing with the help of this parapodium or this sort of orthosis, or with the help of some orthosis, they can sit and ultimately stand, and ultimately they can develop with these special trunk muscles for this propagation. So these are the steps.
So there are also other things. I mean, when you talk about rehab in paraplegia, you have to think about bowel, bladder, skin, muscle, joints, everything. So there are lots of things there, and it's so part of the rehab is to do with bladder training and how you can, now there are a lot of new things for helping to void urine in these patients. So those are areas of fairly specialist management now, but there's a lot happening there which you should have some idea about.
Yes.
But thank you very much, Dr. Pal. That was excellent. I think it's nearly 8 o'clock, so we should call it a close today, and until next week. Bye.
Thank you so much, sir. And I will take Ananda whenever you are free, that then we can arrange for the recent.
Okay. There's a part 2 we can discuss. Okay.
Yeah, sure. Okay.
Thank you so much, sir. Thank you, sir. Thank you, sir.